Cervical Facet Joint Block. Cervical Facet Joint Block is performed for the chronic pain in the neck radiating into the shoulder as well as upper part of the upper extremities. Facet joint pain may be secondary to facet joint hypertrophy, facet joint arthritis, traumatic injury following whiplash injuries after auto accident or work accident. It could be secondary to fall. Facet joint injection is performed either for diagnostic purpose or therapeutic reason. Diagnostic injection is performed to evaluate the cause of the pain, while the therapeutic injection is done to treat the pain caused by facet joint. Facet joint pain is treated by pain medications, physical therapy, cortisone injection, and very rarely surgery. Injection treatment is performed by interventional pain specialist, orthopedic surgeon, or physiatrist. Injection treatment helps to relieve the pain between 3 to 6 months. Injection is repeated after initial diagnostic injections every 2 to 4 months. If the injection lasts for less than 2 months, then patient is considered for facet nerve ablation, which is a different procedure. Facet joint block is performed in the operating room under strict sterilization precautions. Patient is brought into the operating rooms. Patient is asked to lie in prone position with the face down on the operating bed. Image intensifier or X-ray is used for performing this procedure. After patient is positioned on the operating bed, the skin over the neck from the base of the skull to the middle of the thorax is prepped with antiseptic solution as provided by the surgical center and suggested by Joint Commission. Following the skin prep with antiseptic solution, the skin is covered with sterile drip. X-ray is used to identify the facet joint, which is supposed to be injected for either diagnostic purpose or therapeutic reason. Facet joint is identified by oblique view of the X-ray. Anterior, posterior, oblique, and lateral view is initially obtained to identify the facet joint, and once the facet joint is identified, the oblique view is maintained for the injection treatment. Following identification of the facet joint, marking pen is used to mark the entry of the needle point into the skin. The skin subcutaneous tissue underneath the marking area is anesthetized with local anesthesia. Local anesthesia use is 1% lidocaine, and injection is performed by using thin needles such as 25 gauge needle. The amount of injection of 1% lidocaine is between 1 to 2 cc. Multiple facet joints are performed at the same time. Between 2 to 4 facet joint injection may be performed at one time. So the volume of the local anesthesia is restricted between 1 to 2 cc's. After injection of the local anesthesia, the spinal needle, either 22 gauge or 23 gauge, is inserted through the skin subcutaneous tissue towards the facet joint. Once the needle is placed under the X-ray or the facet joint, the needle is tried to pass into the facet joint. Arthritic facet joint may not allow the needle to pass through the bony fragments. The injection is performed after the dye injection. After the needle is entered into the facet joint, the dye is injected. The dye injection could be anywhere between 0.1 cc to 0.3 cc. After the dye injection, the needle position is maintained in the facet joint and therapeutic injection is performed, or injection is performed just with local anesthesia. Diagnostic injection is performed with only local anesthesia such as bupivacaine, which is a long-acting anesthetics. Therapeutic injection is performed by using local anesthesia such as bupivacaine with cortisone. Multiple facet joints are blocked at one time. For diagnostic injection, there may be 1 or 2 facet joint blocked at one time, but for therapeutic injection, multiple joints are blocked if diagnostically it is concluded that multiple joints are causing facet pain. The reason multiple joints are blocked same time for therapeutic purpose is to prevent patient coming back to the operating room several times. After the procedure, patient is transferred into the recovery room and observed for pain relief as well as any other complications.